Each person needs to understand the person's role and where to call the other person, and the other person should not look at the other person to be inferior. Because even the place of the cleaner in that labor room is very, very important. If you deliver at the end, the cleaner doesn't clean, what happens? The people will come in and take infection.
He said there are some doctors when he communicates with them, they respond immediately. Probably they have understood his competencies and they know that if he's saying like this, it means that that is what he's saying.
Working with different doctors, because this was a doctor just from school, we have not really worked for a long time, and maybe just having an experience with one doctor can maybe cause you to draw conclusions that all doctors are like that.
Yeah. You are going to a unit and they tell you, please, can you call this doctor for me? The reason is because either the nurse or the midwife has not mastered her profession, her skills so well to articulate her points, or the doctor has built a barrier around him and he feels scared even to talk to him.
It was 50-50. So this woman at that active phase, she was there for more than 8 hours. We told this doctor that as this woman is at this level, the level is not progressing, it's better for us to do a cesarean section than to keep her at this point for a very long time. That woman finally made 24 hours. And then at the end of the day, she delivered that baby and the baby died.
Once more, welcome back to the continuation of the previous episode. And before you came, Justin, we were sharing stories of midwives having to go through conflict situations in order to protect the life of the mother and the baby. And Jones, as you rightly said, there are a lot of things that needs to be done. But I know you've had also some experiences working with different medical doctors. Can you share with us?
Okay, thank you, Elvis, for the opportunity. I want to share a very pathetic experience I had with a doctor. There was this pregnant woman, she came in labor, and that was her first pregnancy. So we assessed her, she was not yet in the active phase like yes, like she explained. So this lady stayed, she finally entered the active phase and made more than 8 hours still at the same level, because normally labor is supposed to progress. Then we called this doctor and explained to him. First of all, when that woman came, we assessed her. That baby was macroscopic baby. Weight was the estimated birth weight was 4.2, and then since she was pregnant for the first time, her stage 2 was short. And then when we assessed her pelvis, we saw that it was a borderline, meaning that the chances of delivering normally and that of that means it was 50-50. So this woman at that active phase, she was there for more than 8 hours. We told this doctor that as this woman is at this level, the level is not progressing, it's better for us to do a cesarean section than to keep her at this point for a very long time. That woman finally made 24 hours. And then at the end of the day, she delivered that baby and the baby died. Simply because the doctor did not listen. And if he had listened to take an action, would have saved the life of that baby. So that woman was traumatized. And another case, like I said, working with different doctors, because this was a doctor just from school, we had not really worked for a long time, and maybe just having an experience with one doctor can maybe cause you to draw conclusions that all doctors are like that.
Yeah.
But I've also worked with some other doctors that really listen to you. Like when you give an input, they say that no, they see that what you are saying, they take action based on that. So my take about this is that even as a midwife, as a nurse working in a maternity, you need to have the competence, because when they also realize that you know your work, you've mastered your work, they'll be able to listen to you. But if they see that most of them, when you call them, what you tell them is not coherent, it's not in line with their own findings, they will not
with their expectations,
with their expectations or the reality, they will not even believe you. So as midwives, we need to make sure that we master our work.
Managing a team of nurses, midwives, and medical doctors, can you share with us your experiences middle between medical doctors and nurses or midwives?
Yeah, it has been very, very challenging because sometimes you are going to a unit and they tell you, please, can you call this doctor for me? The reason is because either the nurse or the midwife has not mastered her profession, her skills so well to articulate her points, or the doctor has built a barrier around him and they feel scared even to talk to him. And for a team, that is a very big weakness that we need to look for ways to resolve it. Yes, as Mr. Jones said, that we need to, that the nurses and midwives, we cannot blame all the doctors all the time.
Yeah.
Sometimes, as we know, midwives, they know this. You need to use, they say, use a baton. And sometimes it is filled even after delivery. And that is a very bad practice. That pathogram is to help them take a clinical decision. They know when to call. But when you are not using, sometimes it becomes too very difficult for you as a nurse or a midwife to call the doctor. Or you see a situation, somebody calls the doctor that this patient is behaving, is doing this, whatsoever. And the doctor asks simply for the vital signs. They are not available. You see, next time you will not want to call. You need to even to, before you call, you should have it in hand. Because sometimes it triggers the doctor to know how urgent what you are presenting is. So we don't need to push always to the doctors. And most often, I believe, he said sometimes there are some doctors when he communicates with them, they respond immediately. Probably they have understood his competencies. And they know that if he's saying like this, it means that that is what is there. Likewise, that is the same thing I feel that sometimes nurses might have difficulties also approaching these doctors for this one reason. They are not, they are, even you are taking care of the patient that you don't master.
That goes to tell us that as nurses and midwives, we need to do our work, and then we begin to call others for not doing theirs. Because sometimes you want to call another person for not doing it perfectly, meanwhile, you also have gaps in your own practice. Jones, where do we live from here? What is the way forward?
Thank you. We've been communicating.
Mhm.
I think that holding sessions like this, I
Yeah.
think that this one way, because when people see this, the word is they can be able to say that yeah, if people have started thinking about this, someone will know that this is the same situation I've been facing. They
Yeah.
were able to stand up.
Mhm.
And then now holding our conference meetings that we hold even in the hospitals,
Yeah.
we need to begin to talk about these things.
Yeah.
That as a team, we need to work as a team. Each person needs to understand the person's role and where to call the other person, and the other person should not look at the other person to be inferior.
Yeah.
Because even the place of the cleaner in that labor room is very, very important.
Yeah.
If you deliver at the end, the cleaner doesn't clean, what happens? The baby will come in and take infection.
Yeah.
So you don't just need to say you are a cleaner and treat the person badly or talk to the person anyhow. So I think we need to begin to hold those meetings. We need to communicate and make doctors to understand the place of midwives, especially when it comes to maternity.
Yeah.
Because when you look at maternity care, the place of midwives cannot be overemphasized.
Yeah.
The doctors they only come in when there is those complications that are there and beyond the midwife. So when they call them, they really need to take time and listen and then see into it if what they are telling them is the reality and then take action.
Experienced that very situation where midwives plot pathograms after delivery. What is the way forward from here? How do we prevent the plotting of pathograms after delivery? Because this looks for me like a formality. They are doing it like a formality. It's not like a monitoring tool that will help them to take clinical decisions. How do we solve this particular problem?
I think one of the best ways as a supervisor pop in when somebody is in labor and you say, wow, how long has this person been? You just ask casual questions. You are not coming like policing. You are just, how has she been? When did the labor start? At what stage is the labor? And maybe you ask for the pattern. Because at that time, they will not have it. Even if it's there, it will be somewhere and there's nothing written on it. Maybe just the name of the patient. And with that, you don't punish. You call them and explain to them again the need for them. Because it helps them. Even though it helps to protect the mother, then it helps you so that you feel fulfilled at the end of the day. When a woman delivers, when you are celebrating, midwives, they tend to celebrate most of the time.
Yeah.
And when the outcome is bad, everybody feels bad.
Yeah.
And that is why even when you look at the level of policymakers, they do this maternal death auditing, and these things should not be happening. They want that the maternity should remain a place for celebration.
Yeah, a place for celebration, and we need to make sure that our maternities they remain a place for celebration. And having people like you with your insightful discussions is going to throw more light on what happens, what we need to do to make sure that we keep serve our newborn babies, keep our mothers, serve our wives, and to create a country, a world that everybody wants to deliver. And if you want to deliver in the hands of a healthcare team that is competent, that values communication, fruitful communication that is based on trust, I think everybody will want to become a midwife. And not only a midwife, but every other person will want to deliver. So once more, thank you guys for coming. And as usual, if you did follow us through the end of this discussion, don't forget to like our videos, don't forget to comment and tell us what you think about the discussion from today's conversation. Thank you for coming.
Thank you.